to start with the O'Brien's test. So I'm going to have the patient with their arm out in front with their thumb facing down, and they are just going to elevate their arm while they resist me pushing them up or down. And if there should be pain with this, and if they flip their arm over with their palm facing up, go ahead and resist. Good, and elevate. And there should be decreased pain. These two signs would indicate an AC injury. Next, I'm going to do the compression test or the crossover maneuver. So I'm just going to have the patient bring their arm up, kind of just like that stretch. And if there's any shoulder pain, this indicates an AC injury. Next, I'm going to do the AC resisted extension test. So I'm going to have the patient start with their arm out in front like this. And they're just going to horizontally abduct while I push, and they resist. Good. So if there is shoulder pain, this indicates an AC injury. Next, I'm going to do the painful arc sign. So what I'm going to have them do is abduct their arm all the way up and bring their arm down. And between 60 and 120 degrees, if there's any pain, this could indicate a possible subacromial pain syndrome. Next, I'm going to do the Hawkins-Kennedy test. So I'm going to have them kind of start with their arm out in front like this. And I'm going to internally rotate their arm while I keep their arm at 90 degrees. And if there's any pain or apprehension, this could indicate a possible subacromial pain syndrome. Next, I'm going to do the external rotation lag sign. So what I'm going to do is I'm going to externally rotate their arm for them. So I'm going to have them bend their arm, and I'm going to externally rotate their arm for them and kind of stop about right here. And what I'm going to do is I'm going to let go and see if the patient can hold this. And if their arm starts to go in slowly like this, this indicates they're weak, and if there's any pain, this can indicate an infraspinatus or a teres minor injury. Next, if they do not bring their arm in for the external rotation lag sign test, that indicates that it's negative. And if the test is negative, what I would do is I would do the external rotation strength test. So I'm going to have them hold their arm out like this. And I'm going to have them externally rotate while they resist me. Go ahead. And if there's any weakness or pain, this indicates an infraspinatus or a teres minor injury.